ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ, ਸਵਾਗਤ ਹੈ ਤੁਹਾਡਾ ਸਾਰਿਆਂ ਦਾ ਇਨਫੋਕਸ ਦੇ ਵਿੱਚ। ਮੈਂ ਹਾਂ ਰੁਪਿੰਦਰ ਕੌਰ। ਪੈਂਡੈਮਿਕ ਦੀ ਸ਼ੁਰੂਆਤ ਨੂੰ ਕਰੀਬ 1 ਸਾਲ ਤੋਂ ਵੱਧ ਦਾ ਸਮਾਂ ਹੋ ਚੁੱਕਾ ਹੈ। ਪੈਂਡੈਮਿਕ ਦੀ ਸ਼ੁਰੂਆਤ ਤੋਂ ਹੀ ਅਸੀਂ ਦੇਖਦੇ ਆ ਰਹੇ ਹਾਂ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰਸ, ਫਰੰਟਲਾਈਨ ਵਰਕਰਸ ਵੱਲੋਂ ਕੰਮ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ। ਗੱਲ ਓਨਟਾਰੀਓ ਦੀ ਕਰੀਏ ਤਾਂ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੇ ਡਾਕਟਰਸ ਵੱਲੋਂ ਪੂਰੀ ਤਨਦੇਹੀ ਨਾਲ ਕੰਮ ਕੀਤਾ ਗਿਆ ਹੈ। ਹਾਲ ਹੀ ਦੇ ਵਿੱਚ ਡਾਕਟਰ ਐਡਮ ਕਸਾਮ ਨੇ ਨਿਊ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਵਜੋਂ ਅਹੁਦਾ ਸੰਭਾਲਿਆ ਹੈ। ਹੁਣ ਕੀ ਕੁਝ ਪ੍ਰਾਇਓਰਟੀਜ਼ ਰਹਿਣਗੀਆਂ ਉਹਨਾਂ ਦੀਆਂ, ਐਸੇ ਤੇ ਆਧਾਰਿਤ ਰਹੇਗੀ ਸਾਡੀ ਅੱਜ ਦੀ ਹੈ ਖਾਸ ਪੇਸ਼ਕਸ਼। ਦੁਨੀਆ ਭਰ ਵਿੱਚ ਪੈਂਡੈਮਿਕ ਦੀ ਸ਼ੁਰੂਆਤ ਨੂੰ 1 ਸਾਲ ਤੋਂ ਵੱਧ ਦਾ ਸਮਾਂ ਹੋ ਚੁੱਕਾ ਹੈ। ਗੱਲ ਕੈਨੇਡਾ ਦੀ ਕਰੀਏ ਤਾਂ ਕੈਨੇਡਾ ਵਿੱਚ ਪੈਂਡੈਮਿਕ ਦੀ ਸ਼ੁਰੂਆਤ ਤੋਂ ਹੀ ਡਾਕਟਰਸ ਪੂਰੀ ਤਨਦੇਹੀ ਨਾਲ ਕੰਮ ਕਰ ਰਹੇ ਨੇ ਤੇ ਕੋਵਿਡ-19 ਦੇ ਮਰੀਜ਼ਾਂ ਦੀ ਦੇਖਭਾਲ ਕਰ ਰਹੇ ਨੇ। ਇਸੇ ਤਰ੍ਹਾਂ ਜੇ ਗੱਲ ਓਨਟਾਰੀਓ ਦੀ ਕਰੀਏ ਤਾਂ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੇ ਡਾਕਟਰਸ ਵੱਲੋਂ ਵੀ ਪੂਰੀ ਤਨਦੇਹੀ ਨਾਲ ਕੋਵਿਡ-19 ਦੇ ਮਰੀਜ਼ਾਂ ਦੀ ਦੇਖਭਾਲ ਤਾਂ ਕੀਤੀ ਜਾ ਰਹੀ ਹੈ, ਪਰ ਦੂਜੇ ਪਾਸੇ ਬਾਕੀ ਸਰਜਰੀਜ਼ ਦਾ ਬੈਕਲੌਗ ਇਕੱਠਾ ਹੋ ਚੁੱਕਾ ਹੈ। ਕੀ ਹੈ ਪੂਰਾ ਮਾਮਲਾ, ਪਾਉਂਦੇ ਹਾਂ ਇੱਕ ਨਜ਼ਰ। ਕੈਨੇਡਾ ਭਰ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਕੇਸਿਸ ਵਿੱਚ ਕਮੀ ਆਈ ਹੈ। ਗੱਲ ਓਨਟਾਰੀਓ ਦੀ ਕਰੀਏ ਤਾਂ ਓਨਟਾਰੀਓ ਵਿੱਚ ਵੈਕਸੀਨੇਸ਼ਨ ਮੁਹਿੰਮ ਵਿੱਚ ਤੇਜ਼ੀ ਆਉਣ ਦੇ ਨਾਲ ਕੇਸਿਸ ਵਿੱਚ ਕਮੀ ਵੇਖੀ ਗਈ ਹੈ। ਪੈਂਡੈਮਿਕ ਦੀ ਸ਼ੁਰੂਆਤ ਤੋਂ ਓਨਟਾਰੀਓ ਦੇ ਡਾਕਟਰਸ, ਨਰਸਿਸ ਕੋਵਿਡ-19 ਮਰੀਜ਼ਾਂ ਦੀ ਦੇਖਭਾਲ ਵਿੱਚ ਰੁੱਝ ਗਏ। ਹਸਪਤਾਲ ਤੇ ਬੋਝ ਪੈਂਦਿਆਂ ਵੇਖ ਫੀਲਡ ਹਸਪੀਟਲਸ ਵੀ ਤਿਆਰ ਕੀਤੇ ਗਏ ਤੇ ਸਾਰੀਆਂ ਸਰਜਰੀਜ਼ ਨੂੰ ਅੱਗੇ ਪਾ ਦਿੱਤਾ ਗਿਆ ਤੇ ਸਿਰਫ ਕੋਵਿਡ-19 ਪੇਸ਼ੈਂਟਸ ਨੂੰ ਹੀ ਤਰਜੀਹ ਦਿੱਤੀ ਗਈ। ਪੈਂਡੈਮਿਕ ਦੇ ਚਲਦਿਆਂ ਕਰੀਬ 15 ਮਿਲੀਅਨ ਸਰਜਰੀਜ਼, ਡਾਇਗਨੋਸਟਿਕ ਐਗਜ਼ਾਮ ਤੇ ਹੈਲਥ ਕੇਅਰ ਦਾ ਬੈਕਲੌਗ ਹੋ ਗਿਆ ਹੈ। ਪੈਂਡੈਮਿਕ ਦੌਰਾਨ ਕਈ ਲੋਕ ਆਪਣੇ ਡਾਕਟਰਸ ਨੂੰ ਨਹੀਂ ਮਿਲ ਪਾਏ, ਜਿਸ ਕਾਰਨ ਕਈ ਕੰਡੀਸ਼ਨਸ ਅਨਡਾਇਗਨੋਸਡ ਜਾਂ ਅੰਡਰ ਡਾਇਗਨੋਸਡ ਰਹਿ ਗਈਆਂ। ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਮੁਤਾਬਕ ਫੈਮਿਲੀ ਫਿਜ਼ੀਸ਼ੀਅਨਸ ਵੱਲੋਂ ਵੇਖੇ ਜਾਂਦੇ ਸਕਰੀਨਿੰਗਸ ਤੇ ਪ੍ਰੋਸੀਜਰਸ ਦਾ ਵੀ ਵੱਡਾ ਬੈਕਲੌਗ ਹੋ ਗਿਆ ਹੈ, ਜਿਸ ਕਾਰਨ ਜਿਨ੍ਹਾਂ ਵਿੱਚ ਜ਼ਿਆਦਾਤਰ ਕੈਂਸਰ ਡਿਟੈਕਸ਼ਨ ਤੇ ਕਾਰਡੀਅਕ ਟੈਸਟਿੰਗ ਵੀ ਸ਼ਾਮਲ ਨੇ। ਇਸ ਬੈਕਲੌਗ ਨੂੰ ਕਲੀਅਰ ਕਰਨ ਵਿੱਚ ਮਹੀਨੇ ਲੱਗ ਸਕਦੇ ਨੇ। ਸਿਰਫ ਇੰਨਾ ਹੀ ਨਹੀਂ, ਪੈਂਡੈਮਿਕ ਦੇ ਚਲਦਿਆਂ ਮੈਂਟਲ ਹੈਲਥ ਕੇਸਿਸ ਵਿੱਚ ਵਾਧਾ ਹੋਇਆ ਹੈ, ਜਿਸ ਦੇ ਲਈ ਆਉਂਦੇ ਸਾਲਾਂ ਵਿੱਚ ਔਨਗੋਇੰਗ ਕੇਅਰ ਦੀ ਲੋੜ ਹੋਏਗੀ। ਜੇ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਕਮਿਊਨਿਟੀ 120% ਕੈਪੈਸਿਟੀ ਨਾਲ ਕੰਮ ਕਰਦੀ ਹੈ ਤਾਂ MRIs ਦੇ ਬੈਕਲੌਗ ਨੂੰ ਕਲੀਅਰ ਕਰਨ ਲਈ 10 ਮਹੀਨੇ, CT ਸਕੈਨਸ ਨੂੰ ਕਲੀਅਰ ਕਰਨ ਲਈ 4 ਮਹੀਨੇ, ਕੈਟਰੈਕਟ ਸਰਜਰੀਜ਼ ਲਈ 21 ਮਹੀਨੇ, ਨੀ ਰਿਪਲੇਸਮੈਂਟਸ ਲਈ 22 ਮਹੀਨੇ, ਹਿਪ ਰਿਪਲੇਸਮੈਂਟਸ ਲਈ 14 ਮਹੀਨੇ ਤੇ ਕਾਰਡੀਅਕ ਸਰਜਰੀ ਲਈ 10 ਮਹੀਨੇ ਦਾ ਸਮਾਂ ਲੱਗ ਸਕਦਾ ਹੈ। ਇਸ ਦੇ ਨਾਲ ਹੀ ਵੱਡਾ ਚੈਲੰਜ ਹੈ ਨਰਸਿਸ ਦਾ। ਬੀਤੇ ਦਿਨੀ ਆਏ ਇੱਕ ਸਰਵੇ ਵਿੱਚ ਸਾਹਮਣੇ ਆਇਆ ਹੈ ਕਿ ਕੋਵਿਡ-19 ਕਾਰਨ ਵਧੇ ਸਟ੍ਰੈਸ ਦੇ ਚਲਦਿਆਂ ਕਈ ਨਰਸਿਸ ਇਹ ਪ੍ਰੋਫੈਸ਼ਨ ਛੱਡਣਾ ਚਾਹੁੰਦੀਆਂ ਨੇ। ਸਰਵੇ ਮੁਤਾਬਕ 26 ਤੋਂ 35 ਸਾਲ ਤੱਕ ਦੀਆਂ ਨਰਸਿਸ ਇਹ ਪ੍ਰੋਫੈਸ਼ਨ ਛੱਡਣ ਬਾਰੇ ਸੋਚ ਰਹੀਆਂ ਨੇ, ਜਿਨ੍ਹਾਂ ਦੀ ਗਿਣਤੀ 13% ਹੈ। ਇਸ ਦਾ ਅਸਰ ਹੈਲਥ ਸਿਸਟਮ ਤੇ ਪੈ ਸਕਦਾ ਹੈ ਤੇ ਪਹਿਲਾਂ ਤੋਂ ਹੀ ਬੈਕਲੌਗ ਵਿੱਚ ਚੱਲ ਰਹੀਆਂ ਸਰਜਰੀਜ਼ ਤੇ ਵੀ ਇਸ ਦਾ ਅਸਰ ਹੋ ਸਕਦਾ ਹੈ। ਹਾਲ ਹੀ ਦੇ ਵਿੱਚ ਡਾਕਟਰ ਐਡਮ ਕਸਾਮ ਨੇ ਓਨਟਾਰੀਓ ਮੈਡੀਕਲ ਐਸੋਸੀਏਸ਼ਨ ਦੇ ਨਵੇਂ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਵਜੋਂ ਅਹੁਦਾ ਸੰਭਾਲਿਆ ਹੈ। ਹੁਣ ਕੀ ਕੁਝ ਪ੍ਰਾਇਓਰਟੀਜ਼ ਰਹਿਣਗੀਆਂ ਉਹਨਾਂ ਦੀਆਂ, ਇਸੇ ਸੰਬੰਧੀ ਖਾਸ ਤੌਰ ਤੇ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ ਡਾਕਟਰ ਐਡਮ ਕਸਾਮ ਦੇ ਨਾਲ। Hello, Dr. Adam, and thank you so much for taking out time for PTC.
Oh, my pleasure. Thank you for having me.
First of all, congratulations on this new role, on being the youngest president of Ontario Medical Association.
Thank you so much. It really is an honor and a pleasure to serve my physician colleagues across the province, and I'm really excited to do the job as best as I can.
So with this new role as the youngest president of Ontario Medical Association, what will be your priorities now?
Well, so I have 3 major priorities that I'm really interested in accomplishing over the course of the next 12 months. The first, of course, is member advocacy, and we serve 43,000 doctors from Timmins to Toronto, from Ottawa to Orillia, and so my focus has always been and will always be to ensure that the physicians of Ontario have a strong voice as their leaders and in their leadership. My second main priority, of course, with COVID is health system partner engagement. We know that over the course of the past 12 to 18 months, we have seen a significant upheaval in our health system. And what we really want to be able to do moving forward is to ensure that our health system and our partnerships with our health system stakeholders is robust so that we can get the job done of continuing to deal with COVID, but also to transform our healthcare system into the future. And then finally, we at the OMA is undertaking a significant modernization of our governance in our association. And so this is going to be a continuous focus for me and my colleagues over the course of the next coming months to ensure that we have an organization that continues to be effective and supportive of our members.
But when you talk about the effective organization, past president Dr. Samantha Hill, she raised a voice, a concern for the gender gap in Ontario Medical Association. So going forward, how will you plan to deal with that?
Well, we're going to continue to work on all of these factors when it comes to pay equity. We know that, of course, the gender pay gap is a real phenomenon, and we're focused on managing and certainly solving that issue with our health system partners, because ultimately this has to happen through collaboration with government, with our health system partners, to really move the needle on this issue. We also know, and at the OMA, we are committed to diversity, equity, and inclusion in a number of different areas. And we want to be leaders in all of these different spheres. And so I look forward to being able to do the hard work to ensure that we are continuing to work towards equity in all areas of our system.
So looking at the situation of the pandemic in the province Ontario, lowest case counts and vaccination rate is going up. Being the medical professional, how do you see these numbers?
Well, I'm very encouraged right now by the numbers. I will say that, over the past several months, my wife and I, she's a family doctor, we have been in vaccination clinics where we've been vaccinating members of our community, of our population broadly across the province. And we are very encouraged by, of course, increasing vaccination rates, but also declines in the case numbers, hospitalizations, and ICU numbers. And so we know what that really means is that the vaccines are working. The vaccines are working to ensure that our populations are safe. What we really want to do right now in the last mile or last kilometer of this effort is to get as many people fully vaccinated as possible. We know that those numbers are good. We need to get them better. We need to put more doses in arms. We need to have everyone as fully vaccinated as we possibly can. And that will really allow us to chart a course forward for success during this reopening that we're experiencing.
And what would be Ontario Medical Association's recommendations to the province when the province is reopening?
Well, of course, we always recommend to the province to follow the advice of the public health authorities, follow the science, follow the evidence. And at the OMA, we are here to support any of that evidence that's needed in order to make the decisions that the province undertakes. What we really would like all of our health system partners, and frankly, everyone involved in this effort, is to really understand that over the course of the next 2 months, we have a great opportunity to get as many people vaccinated. And for those folks who are maybe on the fence, who are maybe a little bit concerned about the vaccines themselves, I encourage them to reach out to their family doctors, to reach out to their pediatricians, to have a conversation with them, because ultimately having really good information is the real way to really combat the misinformation and disinformation that we're seeing in a variety of different areas. So our doctors are available, they're the experts, they have the medical knowledge, they have the expertise, and we really want them to be able to have a conversation with people that they trust, and patients should know that their doctors are available.
Dr. Adam will continue this conversation with you, but it's time for a short break. So जल्द हाजिर होने एक छोटी जही ब्रेक तो बाद इनफोकस दा सफर ऐसे तरह जारी रहेगा. Dr. Adam, if we look at the pandemic, it's almost more than a year, and this pandemic has exposed the hardships diverse communities have faced. So going forward, how do you plan to deal with that?
Absolutely. There's no question that we have seen the impact of COVID on racialized and marginalized communities in ways that unfortunately have not been borne out in other areas. And so what this demonstrates is that there has been a traditional and perhaps a historic lack of resources in certain areas and certain environments that we need to really recalibrate. We really need to focus on the areas that are hardest hit to not only ensure that we are supporting them now, but also to pandemic-proof the future so that whenever and if ever this happens again, we're not put in the same situation where these marginalized and racialized communities are being affected in disproportionate ways. So basically having the appropriate resources, having the appropriate level of expertise in these areas is really crucial moving forward.
But during this pandemic, there is now backlog of surgery. So how Ontario doctors are planning to deal with this backlog? What is the solution for that?
Absolutely. There has been, over the course of the past 16 months, the OMA has actually released a study that we've undertaken that shows that 16 million points of care have been delayed throughout the pandemic. That means that one for every Ontarian in terms of diagnostic, procedural, surgical delays, but also delays in things like mental health assessments and primary care assessments. And it really runs the gamut of our entire healthcare system. There's no doubt that that we need to adequately and sustainably resource our recovery for the backlog to be really taken over in terms of proper work. We also know that we're going to have to deal with things like load sharing across the province. We're going to try and build collaboration and bridges between institutions so that some of that work can be done collaboratively, where it perhaps previously has been done in silos. So not only is this an opportunity to transform the healthcare system, but it certainly is a real and evident issue right now for the people of Ontario, and Ontario's doctors are going to have actually a whole suite of solutions to offer in the coming days and months as we release our healthcare platform for the future.
But as a part of the Ontario budget, we saw Ontario government also plan to deal with the backlog surgeries, and they announced to develop a centralized provincial list for the procedures. So had this been already started, and how will this help?
So it hasn't yet been implemented, and certainly the notion of having a centralized referral list is one with merit, and that needs a little bit more discussion. There are other jurisdictions around the country that have a similar model and have found that model to be quite successful. And so really this comes back down to collaboration, building partnerships between institutions, and ultimately, as we start building these programs, making sure that the people of Ontario and our patients are getting the care when they need it at the time that they need it. And I think that that really is our goal, that we really want to provide excellent, high quality, world-class care at the times that our patients really need it.
But Dr. Adam, recently there was a survey that registered nurses, they are leaving the profession after COVID-19. So how OMA is planning to deal with that, and how the surgeries will take place when there will be shortage of nurses?
Well, we know that healthcare is a team sport, and we know that Health Human Resources have always been top of mind for our organization, especially an organization that serves the interests of the physicians of Ontario. And what we know to be very clear is that there are physician shortages in areas across the province, places like rural communities and the northern communities, and these are examples of just how important the physician community is to the healthcare of Ontario. And what we really need is a roadmap for how we can successfully deliver care to these remote areas, but also realizing that there exists backlogs of care right now in the province that we also want to be able to tackle immediately. And so we know that the doctors of Ontario are here to be provide that expertise, that leadership, and the path forward.
Dr. Adam, if we look at the COVID-19 variants like Delta, now Delta Plus and Lambda, how concerning is that?
Well, I think that we're always concerned about variants. I think that what we are seeing in other jurisdictions around the world, whether it's in Israel or the United Kingdom or even in the United States, we really need to continue to monitor the situation on a go-forward basis. What we are also, however, encouraged by is that the vaccines seem to, in some respect, be very successful against those variants. So really what we are trying to do collectively as a system, but also as a healthcare community, is to encourage as many people to get fully vaccinated right now so that they are fully protected against this disease now and into the future.
But Dr. Adam, we know the vaccination is the key, as the government and OMA doctors are always saying that vaccination is the key and every eligible Ontarian should get vaccinated as a priority. But everyone wants to know when this pandemic will get over. We know it will not end overnight, but one sign when this will get over?
I wish I had the answer to that question, but I do think that we are getting ever so closer to that goal. I think one thing that your viewers and all of us should understand is, while we're getting to a point in Canada where we're seeing very good and robust vaccination rates, we know that the rest of the world is not necessarily as fortunate. And so areas around the world that haven't received vaccine, for these areas, for these countries, for these jurisdictions, for these populations, the pandemic is still a very real thing. And so until we get an equitable and a worldwide distribution of the vaccine so that the virus around the world is well controlled, we might have to be living with some of these precautions in terms of these variants for some time. But I'm optimistic that as people start to reopen in Ontario, I know they just announced that they're going to be reopening stage 3 a little bit earlier than it was previously forecasted. I think that as people can do the things that they were once able to do a bit more normally, that's sort of an indication of how and when the pandemic will end.
And I'm sure everyone is waiting for that. Well, thank you so much, Dr. Adam, for taking out time for PTC. At the end, as a medical professional, do you have any advice for our viewers?
Well, first of all, I'd like to thank you for having me on your program. It's really awesome to connect with your audience, and I just want the people of Ontario and your viewers and your listeners to know that doctors know just how hard you've had to sacrifice throughout this pandemic. It has touched everyone in a very specific and very personal way. And we appreciate your sacrifice. We want you to get fully vaccinated so that we can all return to a normal very soon. But we appreciate and understand just how hard this past little while has been. And we thank you for your sacrifices.
Thank you so much. ਸੋ ਹੁਣ ਤੱਕ ਲਈ ਇਨਫੋਕਸ ਵਿੱਚ ਬਸ ਇੰਨਾ ਹੀ। ਫਿਲਹਾਲ ਮੈਨੂੰ ਦਿਓ ਇਜਾਜ਼ਤ। ਤੁਸੀਂ ਰੱਖੋ ਆਪਣਾ ਖਿਆਲ ਤੇ ਦੇਸ਼ ਦੁਨੀਆ ਦੀਆਂ ਖਬਰਾਂ ਲਈ ਬਣੇ ਰਹੋ PTC ਦੇ ਨਾਲ।